This Be More Lifestyle segment is sponsored by the Maryland Proton Treatment Center.
The Maryland Proton Treatment Center is a state-of-the-art facility offering a fully integrated system of image-guided proton therapy. And joining us is Dr. Matthew Witek, Medical Director of the Maryland Proton Treatment Center. Thank you so much for joining us, Dr. Witek.
Good morning, and thank you for this opportunity to discuss this very important topic.
Absolutely. So if you've had cancer before, what should you do when your cancer then returns, Dr. Witek?
So first, I'd like to reassure patients and their loved ones, if they do have a tumor recurrence, it can be a challenging situation, but there are a number of treatment options that are available, and good outcomes are very possible. That being said, in the recurrent setting, it is a more challenging situation. It's challenging because the normal tissue that surrounds the tumor that was there in the previous radiation course is more sensitive to additional radiation. This increased sensitivity may lead to more side effects and more significantly severe side effects during additional radiation treatment approaches. For this reason, proton therapy like we offer at the Maryland Proton Treatment Center is an ideal treatment for the patients in this situation.
So, Dr. Witek, why is proton therapy a good option for that recurrent cancer?
Sure. So proton therapy is it's an advanced form of radiation therapy. The benefit of proton therapy in the reradiation setting is that it's able to deliver a high dose of radiation, hopefully a curative dose of radiation to the primary tumor that's already been irradiated, while reducing the dose to the tissue surrounding the tumor that's already been irradiated. And by reducing this dose, we tend to reduce the side effects and the toxicity of additional radiation treatment approaches.
And can proton therapy be used for non-recurrent cancers?
That's a great question. So at the Maryland Proton Treatment Center, I would say 20 to 25% of our patients had already received radiation, so the recurrent setting. But that leaves the vast majority of our patients that are treatment naive, so patients that have not received radiation before. So we treat newly diagnosed brain tumors, lung tumors, breast cancer, prostate cancer. We treat pediatrics that have newly diagnosed cancer. We treat middle-aged patients and all the way to geriatrics. So we treat recurrent cancers, we treat naive tumors. And again, the benefit of the proton therapy is we're delivering a high dose to the tumor while reducing dose to nearby structures and reducing side effects for our patients.
And lastly, Dr. Witek, for those with cancer, when is it the right time to ask about protons?
Sure. So if you look at all of the cancer patients diagnosed, approximately half of them will receive some form of radiation during their cancer treatment. All the physicians at the Maryland Proton Treatment Center are specialized in different disease sites. They're trained in proton and traditional or photon x-rays. So I recommend at the earliest possible stage of your diagnosis to reach out to one of our specialists. We will get you in for a consultation within a few days. We will discuss all of your treatment options, whether it be proton, photon, or even something called thermal therapy, which we offer at our center. If we can't help you, we have a huge multidisciplinary team associated with the University of Maryland and surrounding doctors, and we will find the treatment that's best for you.
Awesome. Thank you so much, Dr. Witek, for that potentially life-saving information.